Hey, how's it going, everyone? This is Carlos St. Just, licensed acupuncturist, holistic healthcare provider. I wanted to speak briefly on the subject of swelling and edema. And what is edema? That is a collection of fluid in the body in certain areas. It can happen in the hands or in the feet, primarily in the extremities. And I want to speak about more of an edema that happens from a trauma, or if we're recovering uh, from that, or there could be many other reasons. There could be issues with the kidneys, or I can say issues in the area of nephrology, or it could be related to diabetes, could be related to congestive heart failure. So we want to look at a number of reasons why the feet swell, and look at why some of the other extremities do swell. Now, if a patient is presenting these symptoms in my clinic, in my presence, I'm going to take a history, such as asking if they've had any history of congested heart failure or any lung issues or heart issues, looking at distinguishing between the two types of edema. We have a pitting edema and a non-pitting edema. And the difference is, for instance, if I were to put my thumb on the area that is affected, would there be an indentation? And if there would be an indentation, that would be considered a pitting edema. If there is no indentation, that's considered a non-pitting edema. And that's important because it can help you to determine how long the edema has been there, right? Besides, if the patient has told you, but it helps you to determine uh, uh, basically the length of time and the severity of the edema. So, in traditional Chinese medicine, we do have a diagnosis and symptoms for retention of water. We associate it with a condition called dampness, and it can combine with another condition called wind and create wind dampness, or you can create water wind dampness. Uh, there's a condition of kidneys overflowing, right? Water overflowing in the body, and that may not sound practical if you're coming from a science, more biological, biochem science background with no maybe previous knowledge of traditional Chinese medicine, right? So, you know, try to put aside some of the, I would say, not rational thinking, but whatever thinking you're using in that system, and try to look at the symptoms that are being presented. So, when making these videos, I'm doing this off the top of my head here because I want to, one, it's good to see what you know, and I present the information as if I was being presented by a patient, right? The information was being presented by a patient to me, and what would be my best idea, my best suggestions at the time, and hopefully they help. I see currently I'm treating a patient who is experiencing swelling in one of their extremities, and it's from a previous injury, and the injury hasn't healed completely, and this patient is experiencing issues with pain and the swelling, and a little bit of the pitting aspect. And so with the acupuncture treatment, what are we doing? Are we trying to improve the circulation? Are we trying to remove the excess water or excess fluids or whatever exudates are within the area that's damaged, right? What are we trying to do? That's all of it. Reduce the pain, reduce the swelling, improve the circulation, reduce the inflammation, move the right, call in the right neurotransmitters and activate the right neurotransmitters and neurochemicals, and help to alleviate and create a response that will promote a more positive change. And so I just wanted to explore this subject, and if it, depending if it's on the hand or on the feet, if it's one hand or both hands, or 1 foot or both feet, usually both feet, if dealing with some type of internal medicine disorder. And as far as treatment for herbs, do we use herbs? Yeah, there's formulas that we use, and I'm not gonna just name them out so you can go get them. You don't just take them, right? Find something that is okay. It says this works for this. You just take it. You see a practitioner and you see if the formula, right? The practitioner will determine if you're a good candidate for the formula, and if you are, then they can prescribe you the formula and then monitor you in terms of making sure that you're not getting any of the bad side effects. So when presented with these symptoms, when someone comes in, I'm trying to be as accurate, and also thinking of Chinese medicine diagnosis and herbs. There's different formulas. Wuling Sun. There's Fuling, which is used for draining the dampness in Chinese medicine. Drain any kind of. You can maybe liken it to some sort of diuretic effect. Ren is similar, draining that dampness and even helping to reduce the adipose tissue, the fat, and the acupuncture, right? The acupuncture. So definitely, I'm gonna have more videos. I have been posting more, and as you can see, I'm wearing my mask. Please wear your mask. Please feel free to hit the like button on there so more people can see the video and gain access to the knowledge, and maybe it can be something useful that they can use clinically as well as maybe in their own lives. So once again, and please feel free. If you have any questions, you can always send an email at mailbox@csjacupuncture.com, and I will talk to you soon. Thank you.